Hi, I'm Dr. Rupali Bhatia. Today I'll be answering a few questions about sexual health that are commonly asked to me. Yes, it is absolutely okay to remove hair from your private parts, but do not do it very often because the skin around your vagina is really sensitive. Frequent insults to the skin in form of razor, wax or those creams will result in irritation and thus may cause infection. So do it as per your hair growth, and I would like to emphasize on the fact that while doing it, please adopt hygienic measures. So if you are making a sexual contact while on your periods, the chances of you getting pregnant are almost zero. I would say almost zero and not totally zero. So I would recommend please use a form of contraception while making a contact during your periods. There's a little off smell that is associated with the vagina. That's because it's a combination of vaginal secretions down there along with the little urinary droplets and sweat also. So it's okay if your vagina smells a little off. However, if it's a really offensive smell or is associated with itching, then there may be an infection and you need to see a doctor. So if you are a teenager or nearing your menopausal age or even after delivery, it's quite common to have infrequent cycles or irregular periods. That's okay. But if you have regular periods earlier and then there's a sudden change in your frequency of the cycle or change in the amount of bleeding or there's a change in the regularity, then you should obviously see a doctor. So if you have just begun your sexual activity, there could be a little discomfort down there during first few episodes. However, two things are to be noted here. One, if you have developed pain as a new symptom. For example, if you have had your earlier cycles absolutely pain-free and now you just begin to have pain, then there is a problem. And secondly, if the pain keeps on lingering there or it persists for a longer period of time and is associated with other things like bleeding after contact or repetitive episodes of vomiting after contact, then you should seek help. Pelvic pressure or heaviness in your lower abdomen can be there during your periods or even in the middle of your cycle because then ovulation is going on and there's a little pelvic congestion that again contributes to the heaviness. It's absolutely fine to feel that kind of pressure during these two periods. Secondly, constipation can also be one of the causes when you can feel heavier down there. However, apart from these reasons, if you continue to feel pelvic pressure or pain in the abdomen, then you should seek help. So this one's really most commonly asked to me. A vaginal discharge, yes, can be normal also. A vaginal discharge indicates that you have a healthy vagina. What you need to know is what is a normal discharge and what is not. So a normal vaginal discharge usually is there during the first 15 days of your cycle. It's a kind of a long, thready, stretchy discharge that's translucent in consistency and is usually not associated with any smell. However, if you have any cheesy or sticky kind of a discharge that's associated with a lot of smell and itching, then it's not normal. Then you should see a doctor. There could be an infection down there.